Interested in fixing your care delivery system? We can help. Lean Enterprise Incorporated. Healthcare delivery in the United States is in a period of profound transition. After 20 years of uninterrupted growth, financial and operational pressure on care providing organizations threatens to totally obliterate the status quo. From a patient perspective, the system is in a state of crisis. Escalating costs have eaten up any potential wage improvements for the middle class, causing economic stagnation, with total healthcare costs approaching 20% of the gross domestic product. Outcomes are mediocre compared with other industrialized countries, and service provided is inconsistent, slow, confusing, and generally a mess. Up to this point, the major players in healthcare have been engaged in a zero-sum game, shifting the cost or delivery burden amongst themselves and ultimately back to the consumer. Improvements in quality, delivery, and cost have been virtually unmeasurable as the system gets larger, more complex, and ever more balkanized. Several experiments in the healthcare reform legislation will attempt to use incentives to bring the care delivery process under control. Bundle payments, ACOs, global payment systems. Each of these approaches deal indirectly with the problem, substituting incentives for any holistic answer. It is possible that these approaches will have the desired impact, but we believe the key to financial survival will be to get the care delivery process and care providers aligned to give better value. Part of the problem around healthcare delivery is organizational. Whereas major industries have been forced to vertically and horizontally integrate, this sort of shakeout is a long time coming in healthcare. The basic cultural challenge of integration rests with the mental models which have developed over the past 100 years around specialization, credentialing, and ways of working. Some of the organizational problems are being attacked by healthcare reform and through the independent activities of health insurance providers and care delivery organizations. None of the mental model challenges are being adequately addressed. At Lean Enterprise Incorporated, we've pioneered an approach to getting out of the mess. Our methodology has been proven in both inpatient and emergency settings, and we deliver significant improvements, such as elimination of the need for waiting areas in the emergency department, reduction in length of stay from 25 to 50% in both inpatient and emergency settings, improvements in patient satisfaction, improved capacity to allow for a reduction in the total number of beds, greatly reduced caregiver stress with improved job satisfaction, and far fewer medical errors with mistakes caught in real time by the care delivery team. In short, we've helped increase the value added while lowering the cost of care. Interested? Give us a call. Call Greg Fields, Managing Partner, 508-259-2099.